Hello, everyone. We've got just a few more minutes before we get started. I invite you to take a moment and introduce yourself in the chat and share one positive thing that has come about due to the pandemic. So we all know the limiting things and the challenging things, but some of us are starting to recognize some of the things that are actually a positive outcome. So if you've got one of those to share, please add that to your introduction, and we'll get started in just a few more minutes. Okay, my clock says it's noon, so we'll go ahead and get started. If you haven't done this already, please feel free to introduce yourself in the chat and share one positive thing that has come out for you due to the pandemic. So we've got some great things that people are sharing. Just being able to work from home feels good for some. Spending more time with your family, with your kids. Um, let's see. Christy, does that mean you're late to work or you're not late to work? Let's see.
As of this virus, I'm always on time now. So
There you go. That 10-second commute, right?
the twice on my hallway makes the biggest difference.
All right, very good. Well, thank you everyone for joining in today. We appreciate your presence and we're looking forward to the conversation. Please feel free to put questions into the chat during the presentation so we can get to those when the time is right. So if you go ahead with introductions, I just wanted to make this announcement. Anyone who's on the call should have gotten this message in another mailing, we are having a second Snack, Share, and Learn on Monday, April 20th from 3 to 4 p.m. We've invited an expert panel with people with experience with the SNAP program, the WIC program, as well as people who can share a little bit about how families can make healthy meals from things like the foods available through WIC, or sometimes when they reach out to a food pantry, they'll just get a box of food. So those three people will be available they'll give a little bit of a presentation, but for the most part, they'll be answering questions. So I invite you to, if you have a question, to please go ahead and share that with me. Um, you would have gotten this email, and if you respond to that email, you will be able to get a question to me. The other piece that we're looking for during that conversation are your stories. What's happening where you live? How are the families coping? Where are the issues around food insecurity? Um, how are they surfacing in your community and with your families? Because we really want to get a handle on that. So I invite all of you who are listening now to tune in again on Monday. And if you can today, after we get on the call, if you have some specific questions, please share those with me. Okay, but for today, we will have a little time around Daisy with Sarah Hernandez, and we will also be discussing family engagement and thinking actually about family leadership. So, Sarah, are you on the line?
I'm here, Jean.
Okay, and do you still not have a screen that you want to share?
I still do not have a screen that I would not like to share.
Or
Felt like a
something?
sentence full of double negatives. So,
Uh-huh. Okay, well,
uh,
I will leave this screen up, and if you
okay,
want to turn on your camera, that's up to you, but you go ahead and
I'm live. They can see my face.
okay.
Hello, everyone. Happy Friday. So I am actually not going to jump into Daisy to demo anything for you today. I really just wanted to give you a heads up of a process that we have coming down the pike. Some of you have already may have already been involved in conversations, but we are hosting or completing our annual Daisy user audit for Iowa users in the upcoming weeks. And so this, some of you may be FSSD, some of you may be McV. FSSD is structured just ever so slightly different than McV, and there's a lot more programs. And so that audit process is a bit of a heavier lift than we had anticipated, but instructions will come out soon, but we're working with state leads and also ECI directors on helping understand and get an updated point of contact list for each organization. And so as we are going through that audit process, you all will receive access to the user audit report. And that is simply just to verify your access. And it is a way for us to ensure that folks that don't have access to Daisy shouldn't have access to Daisy. And so it will be kind of supervisors, points of contacts through organizations, and ECI directors who are kind of helping us through that process. And we ask that during that audit time that we don't get 400 or 500 emails directly from you all. So if you are not listed as a point of contact, and please make sure that you are communicating directly with that person. And those are the folks that we actually prefer to hear from, just to help streamline the process. So again, this is a thing that we will do once a year. It's just a data security check to make sure that folks who maybe are no longer with organizations or have maybe moved organizations, that everyone has the right access. So that is coming down the pike, so please be on the lookout. But we do appreciate your support in our efforts.
Okay, thank you so much. All right, now we will move on to our presentation for today. I'm going to invite Lisa Bender to come on the line. She is connected. And Lisa, I will stop sharing my screen so that you can share yours.
All right. Hi, everybody. So in spirit of Jean's a positive thing, so another thing is that I have been taking the lead on our Bureau's virtual happy hour events. I've really embraced technology, and last night we did a Zoom chat based on pop culture. I'll just throw up my background theme and see if you guys have any idea who I might have been. Any wild guesses? I had a bandana around my head and a lot of cheetah print. I was, if you have followed the Tiger King craze, good old Carol Baskin. So I will take that off and not make you look at it the whole time. But another thing that I have just thoroughly embraced and enjoyed about this is just the fun things that you can really do with technology. So Carol B, yep, people knew, they knew. I for those who know, I just have to share, I also had a fake teardrop tattoo on my face here, and a wine glass that might have said the tears of my dead husband on it. This is being recorded. Sorry, but yes, I did it. And we had a good time. So anyways, I've totally embraced this technology. I've realized it's really fun and you can do some cool things. So enough with that. I am going to go ahead and share my screen, and I am going to start my presentation from the beginning. And you should be able to see that. And then before I forget, I'm also going to share my computer sound because we will watch a couple of videos. So hopefully sound is okay. And Jean, if it's not, or if anybody has any trouble or if there are any comments, feel free to let me know.
Okay, right
So
now it sounds good.
Awesome. So yeah, we had some issues yesterday. I think my computer just was really, my connection, for whatever reason, the video is fine, but the audio seems to cut in and out. So I'm using my cell phone on speaker and it's working. So what I wanted to talk to everybody about today is, and we have had even a change since we kind of put out the topic, and that is that we're trying to even move away from using the word family engagement and say family partnership. Really, because for a long time we've thought of family engagement as getting families to do what we want them to, right? We thought of it almost as a means of, if families are engaged, they're participating, they're finishing the class, or finishing with the curriculum or the model, the home visiting model. They see it all the way through, retention's good, they do what we want them to do, right? And really that isn't the idea of engagement that we want to talk about. What we want is families to be engaged, not just doing what we want them to do, but us supporting them and doing what they want to do and them being excited about it. And really moving away from doing for families to doing with. And now I know all of you are involved in this work. So I know I'm preaching to the choir here. I know I'm not telling you any earth-shattering new information that you don't know today. But what I want to do is just remind people again of why it's so important and bring us back to some of the basics. And then also talk about the importance and the intersections between good family engagement, partnership, leadership, equity work, and truly at the core of a lot of it is critical self-reflection. And how are we daily checking in with ourselves to make sure that we're growing constantly with the families that we work with. So as I said, we kind of decided as a group, and I'll talk a little bit about who this group is later, but as a group that has come together, it's a subcommittee under governance, one of the ECI component groups. And we kind of decided just recently that instead of calling ourselves the Family Engagement Committee, we were going to call ourselves the Family Partnership Committee. The word partnership really gets to that core of it's not meant to be an unequal relationship. It's not about us going out to get families to work with us. It's about a true equal partnership. So you may hear me say, though, throughout this, partnership, engagement, leadership, sometimes it'll be interchangeably. This is the way I think about it. I think about, like, if we want to get to authentic partnership with families, these are the things that have to be in place, right? So it starts at the core of who we are as professionals, with that self-reflection and that humility. It requires a commitment to equity work, and that's what leads to sort of that engagement. And then when parents and families are engaged, we're able to share power and encourage them into leadership positions. And that is where we get this authentic partnership. So that's kind of just the framework I think of that helps me. So how we've defined the concept of family engagement, because this is one thing, people all have different definitions. So as a group, we really focused on the National Center for Parent, Family, and Community Engagement, and that comes out of the Head Start world. But they define it as basically an interactive process through which those early childhood professionals, providers, family support workers, home visitors, how these folks work with family members to build those positive goal-oriented relationships in a partnership. So an interactive give and take. Building and maintaining the relationships being a shared responsibility between the family and the provider, and that it's about mutual respect, recognizing the value that families and parents bring to the table. It means doing with families, not doing to or doing for. When we think of family engagement, we think about it being very relationship-based. It's hard to engage with someone or have expectations of someone who you don't have a relationship with, right? Like, I know that if I need something, I know who I have relationships with and who I trust and who I can reach out to and ask for that. And if our families are the same way, if they don't have that trust-based relationship with us, we're not going to have engagement. It's ongoing. It doesn't stop. We don't do the work of family engagement once and say, oh, we're done. It has to be responsive to the strengths and the needs of the family. And this, I think, is some of the most important stuff. It needs to be program-wide, and it needs to be collaborative. When I say program-wide, I mean, a lot of times we think about family engagement as only the work of what our frontline social workers do, right? So if families aren't engaged, certainly it's the fault of a home visitor, right? Well, no, it really is a top-down, bottom-up, all-over type of a thing. You really have to assess as an organization, what do we do? Do we have policies? How often do we ask for feedback? Do we incorporate feedback? Because there's nothing worse than asking people for their feedback and doing nothing with it, right? So how are we asking parents for information? And then how are we taking what they tell us and using that and actually making programmatic changes? And it's really important, obviously, that it supports a child's growth, development, learning, and to begin before birth. Getting back to that, really, what makes it relationship-based means having a strength-based approach with families. And like I said, everybody, we've been talking strength-based approach for decades now. I know it's nothing new. But what I think is important is realizing that to engage families takes more than just this. And I also like to add wherever I can, I didn't hear, but the word authentic, because it's one thing to sort of not always, of course, my boss is calling me. Well, decline. Sorry. I'll call her back later. I'm like, no, I'm in the middle of a presentation. It requires reflecting on your own perspective. So, and we're going to talk about this and dive a little deeper into this, but really looking at, like, what am I bringing to the table? What is my stuff? A lot of clinical programs. So if you want to, get a master's degree in marriage and family therapy, or even social, like, a lot of clinical programs anymore require or highly recommend that people who work with individuals and families go to therapy. It's not just something for someone with a severe persistent mental illness. It is something for everyone to really reflect on your own biases, your own values, what beliefs you hold, and something that, and then when you don't answer your phone, they send a text. Sorry. but learning about their perspective, because you know, it's really hard. We all come with our own stuff. This isn't just a cultural thing. I think a lot of times people too think that only certain people from certain cultures have culture or have traditions or ways of doing things. We all have that. We all have our own beliefs about what is the right way to do something. So really checking in with yourself, and when you know, if I'm having an interaction with a family and I'm thinking, oh, they're not doing that right, is that because I think I'm the only one that knows, or my way of doing that is right? So really recognizing and valuing those funds of knowledge, and I'm going to define that because I'll tell you, the first time I read it, I didn't know what it meant. And really identifying strategies to create that welcome environment. The phrase funds of knowledge was, like I said, I really didn't even know what it meant when I don't come from an education background. I come from a social work background, but really those essential cultural practices, those bodies of knowledge embedded into daily practices and routines of family. So families know best what the culture of their family is. They know what foods everybody likes and what the routine looks like and when they get up and what their favorite movies. I mean, there is just a piece of families that no matter how much time we would spend with them, we would never know or understand them the way that they do. So how do we engage families? A lot of it starts very much at the core of beliefs. It really depends on what we believe about families. What are our own values? What do we think that families have to offer? What do we think their role is in their child's development? Do we believe we're the expert and we'll just tell them what to do and they'll just practice that? Or do we believe that they have something to contribute? And really have to ask ourselves, do our beliefs line up with our actions? So if our beliefs are that we value parents, they're the experts, how do we demonstrate that? How would a family know if they walked into your program or interacted with someone from your program? How would they know that that your program values families? So I would love to ask people to use the chat box, and I don't know that I can see it right now. I think I must not have. There we go. Okay, now I can see it.
Have you got it up? Okay, because I can see it too,
Yeah.
Lisa.
So what I wanted to say is, like, if you're doing work, whether that's a home visiting program or a family support program, or if you work in an office that has a child care facility, whatever, give us some concrete examples. How would a family know? Is it do you have images or posters? Do you have policies in place that once a year you ask families for their feedback on services and you implement it? Do you have a parent advisory council? Do you have, what things do you do, concrete things, to demonstrate a belief that families are valued and are the experts? And so far, I'm not seeing anything come in, but I'm assuming because everybody is typing because they have so many great examples. And because we all hate dead air time. So I'm gonna kind of just keep moving along, but if you have those examples, I'd love to hear it. So let's, I'm gonna try to keep my eye on that little chat box in the corner. Okay, so obviously, again, with those attitudes, those are beliefs, and the beliefs that are important to have that strength-based approach with families are that, acknowledging and understanding that families are first and foremost the most important teachers of their children. They are the first interaction, their first attachments, the first one to teach them to do everything, right? I mean, from fine motor skills to the basics of reading and writing, parents are teachers, right? Nancy said parent input for topics and topics to address the next visit. Yeah, so if you do, especially if you do classes or like a nest or even a component of social interaction, and that have had summer picnics and graduations for teen moms. Yeah, those recognition things, those things are important. They're tiny things, but they mean a lot. Even and not just with families, in our work environment too, right? Like those acknowledgments of a job well done are so important. So here's another. We do an annual parent survey and then go over the results with staff. We do surveys after every group connection to try to add to topics families are interested in. We also do an end of the year picnic. Yes, perfect examples. And I love how you talked about, you do the survey and you go over it with the results with staff, and use that information then to determine your topics. You know, because often, like I said, we do things because you know, it's a requirement or because we have to, and sometimes we fail to follow through with okay, now how do we take that information and make changes so that families feel like their input is being heard. So I'm going to kind of go back to my presentation here, but thank you guys. Really just, you know, really, how are we recognizing the expertise that those parents have, that they have something valuable to contribute? Those relationship-based practices are about, you know, describing observations of a child's behavior and having that open communication without judgment, really reflecting on their perspective, because they have all kinds of additional information to add to us. If a child's behaving in a way that isn't what we're used to seeing, we ask the family, what's going on? Did something happen? You know, they know what's best. So really supporting their competence as parents and focusing on that family-child relationship, which is a multi-generational approach. For a long time, I think we thought like, oh, we have these services for parents and we have services for kids, really focusing on supporting the family as a whole and valuing them, their passion, and again, reflecting on your own perspective. And I'm going to dive a little deeper into that self-reflection piece and why it is so important. And it doesn't matter what level you're at. If you're not a direct service worker, or you're in supervision, or you're in leadership, or you're in administration, or you work in the central office of the Department of Human Services, self-reflection is always key. Asking yourself, how am I incorporating the assets and strengths of the families that I work with into my work? How am I taking into consideration what they have to bring to the table and offer? How do I work on my communication with parents, and what can I do to improve my interactions with families? And really one that's responsive to their unique experience, cultural, linguistic, whatever. These are all I statements, because the point is not how are they to accommodate us, but how are we to really use self-reflection and say, what am I doing wrong here? What could I do differently? Or what, I think about it too with what's in the power, you know, your sphere of control and your sphere of influence. Yes, great questions for a reflective supervision. I agree. Like, I really try to focus. I've learned a lot of lessons in life, and I still have many, 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 many more to learn, right? But over the last couple of years, one of the things that's been a big, like, thing I come back to is I have my sphere of control and my sphere of influence, and the rest, let it go. You just gotta let it go. You know, there are the things I control and how I behave, how I react, how I respond, what I do, what I say. There are things I can influence other people beyond that, letting things go and not personalizing. So really important piece of this work. And another important piece that you just cannot pull apart from this work that doesn't often get presented as a piece of engaging families is cultural humility. And what is cultural humility versus cultural competency? As I said, culture comes, we all know that, in so many different ways, shapes, and forms. It's the values that make us who we are. And for a long time, well-intentioned people really focused on this idea and this concept of cultural competency, implying that you would become an expert and you would know all the things, and then you were sort of done once you gathered all the knowledge you could gather about certain cultures. And really recognizing that, well, there are pieces to that are okay. It's good to know and have information if you're working with a specific population that has experienced specific, you know, political events, wars, things like that. It's good to have that knowledge. where we have to be careful is making vast generalizations about populations. Well, these people do this, and these people do that, and really asking people as individuals, how do they want to be referred? How do they identify themselves? What are their values? So next up, I'm gonna share a short little video. I think I am doing okay on time. So I'm gonna actually try to play the whole thing. I stopped it after about 3 or 4 minutes yesterday, but I think I'm gonna try to play the whole thing because I think there's a really great piece and example towards the end.
One word to describe cultural humility for me is love, actually. If I had to encapsulate cultural humility, or the whole concepts of cultural humility, it doesn't do it justice, but the word that I think of it is essence.
Escuchar.
Being. You.
Opening.
Receive. Compassion.
Love.
The principles of cultural humility offer one more framework to contribute to what has got to be our ultimate goal. Yes, our ultimate goal is that there will be a sense of equity, a sense of equality, and a kind of respect that we are driving forward.
Cultural humility is a multi-dimensional concept, and certainly Melanie Tervalon and I conceptualized 3 dimensions.
The first is lifelong learning and critical self-reflection. And in that critical self-reflection, it is the understanding of how each of us, every single one of us, is a complicated, multidimensional human being. Each of us comes with our own histories and stories, our heritage, our point of view. You're looking at me now. I am very fair-skinned. When I was a little girl, my hair was blonde. My eyes are blue. People often tried to call me anything but African American. I have a history. My identity is rooted in that history. My parents gave me the knowledge of my own social identity, and my own experience in life has created that. I get to say who I am.
The second tenet, after self-reflection and ongoing lifelong learning and development, is this notion that we must mitigate the power imbalances, to recognize and mitigate the power imbalances that are inherent often in our clinician patient or clinician client or service provider community dynamics.
And then finally, the piece that I would offer that Jan and I feel people often either don't read or don't like, which is, and the institution has to model these principles as well.
An African-American nurse is caring for a middle-aged Latina woman several hours after the patient had undergone surgery. A Latino physician on a consult service approached the bedside and, noting the moaning patient, commented to the nurse that the patient appeared to be in a great deal of post-operative pain. The nurse summarily dismissed his perception, informing him that she took a course in nursing school in cross-cultural medicine and knew that Hispanic patients overexpress the pain that they're feeling. The Latino physician had a difficult time influencing the perspective of this nurse, who focused on her self-proclaimed cultural expertise.
It was curious to this Latino physician who, first of all, was Latino, not like all, in his case, not like all Mexican Americans know everything there is to know about Mexican American patients. That wasn't it, but he might have been a resource for that African American nurse in that moment. That she didn't feel like she needed, again, because she had bought into this notion of competence, of cultural competence.
The distinction between cultural humility and cultural competence was that we were in a process and a relationship that had many other layers to it, and that we were less comfortable with with even the term of competence, in a way that I think people understand well, and that it implies, especially for people who are providers and are trained in academia, that you are then all-knowing and all-powerful. And we felt like that was not what was happening for us as we were learning from community and understanding in a very practical way how families were coming to the hospital and feeling as if they really were not being heard from their own heritage and history, and how that impacted what they came to the hospital with that we didn't know anything about, hadn't even a clue about. For us, this is part of the humility piece of it, getting to understand that, not trying to humiliate you, not trying to make you feel bad, trying to help us all understand that life is like this, and to, in a certain sense, be really happy about not knowing.
In April of 1992, in the wake of the Los Angeles riots, following the initial not guilty verdict of the police officers accused of beating Mr. King, the Children's Hospital Oakland community was compelled to meet in a series of highly charged sessions to expose and critique our own patterns of institutional racism, injustice, and inequity. My name is Dr. Melanie Tervalon, and I am Director of Multicultural Affairs here at Children's Hospital Oakland.
I want to thank everybody for coming to what is a celebration for me of this year.
Jan and I had the good fortune, really, to be together in the same place when this work was evolving. Jan and I, while we're several years difference in age, are both African American women, and both raised by women who were teachers. And we come out of that, and fathers who were working men, who come out of that Southern tradition and who participated fully in the civil rights movement in the way that meant that they made sacrifices and their children made sacrifices, and they taught us about those sacrifices and raised us each in ways to understand that we were here to serve.
All right, I had to remember to unmute myself because I wanted to be sure that I didn't contribute to any background. So I did, like I said, I did kind of stop that after the opening yesterday, but that video I had realized is part of a training module on the Institute that I am going to talk about here in a little bit, but it stopped kind of where I stopped yesterday. So I wanted to show that last little segment there, particularly about the situation with the nurse. You know, a nurse who had been through this training, or, you know, I took a class in this, so I know that, you know, Latino patients are just very expressive, or that there's, you know, it's not as bad as they seem to sound. You know, she tried to minimize this person's individual experience based on what she had sort of learned in a class. And those are the kinds of things that, you know, like I said, well-intentioned, we sometimes make mistakes of very often of generalizing populations. So it's a great series. I think it's through PBS, and I think you can catch, that's only one segment of 4. I think it's all available on YouTube if you want to watch it. So as I'm talking about this, like I said, family engagement, it involves all these pieces, that critical self-reflection, that emphasis on equity. And then really the key too is not just staying there, not just staying at engagement and respect and trust-based relationships, but being willing to share power with families, being willing to give up some of our sort of power that exists strictly because we are a professional, and share some of that with the families we work with. So the difference when we talk about parent education as opposed to parent leadership, education is what we're doing a lot of with our services, right? So we might be providing information on parenting, child development, skill building, jobs, financial stuff, all kinds of things. Leadership is a little different. What we want to do is help develop and prepare parents to become leaders, not just within their family, but within their entire community. And when parents feel that they're invested, that they're listened to, that that they have a voice, what we see is communities actually doing better, that they become a really important constituency in improving the public health and safety and environment for children and families. So what we want to do is not just engage families, but then take it even a step further and start looking at how do we make parents leaders in the work that we do. And again, I know it's not novel. I think there are definitely pieces and programs within the state of Iowa that do. Yes, we will. Nancy asked about the sharing. Yes, we will send these out. There are some really great programs that do this work in Iowa. A couple examples. So the Parent Partner Program with DHS that pairs parents who've been through child welfare with families going through the system. The Head Start, Early Head Start has a great parent sort of leadership and policy, parent policy advisory boards, and lots of stuff. That's why a lot of this language and work that we did as a group came from Head Start. And then Jean reminded me of another one, and that is there's a leadership institution through University of Iowa Child Health Specialty Clinics, and really working with parents that are parenting a child with a special health care need or disability. So we tend to have some of these programs in pockets for certain populations, but we've never really had sort of a system-wide, just a leadership academy or program or attempt to really organize parents of young children, just parents who are struggling and just trying to get by, who have a lot to contribute and a lot that we could learn from. And so a lot of research has been done around the benefits of family leadership and what we see out of that. And one of the first things, if you guys all do your protective factor survey, or you know what the protective factors are, and one of the key protective factors is social connectedness, right? So how are we connected to our communities, and do we have those informal supports and those people? Well, family leadership is a great way to support parents with having an active network of other parents. It's also really good in reaching those vulnerable populations who don't always trust the system, that they have felt they can't trust, that it disenfranchised them. It's one of the things we've seen a lot with like our Parent Partner Program, right? Is that parents going through the child welfare system don't trust DHS, and sometimes rightfully so, but they're maybe a little more apt to listen to another parent who's not employed by DHS, but who's been through it. So reaching those vulnerable populations. Parents also help us with collective impact. We tend to get in silos, and it's just the nature of what we do, right? In order to be a specialist in something, you can't be a specialist in everything. So whether it's us coming from an educational perspective or a social work perspective or a medical perspective, we all kind of have our own expertise, but parents interact with all of us. And so they see where they're actually really good system thinkers. They can see where we maybe are missing things that are so obvious to them, right? They cross those silos for us. So they're able to offer sometimes some common sense and point out for us where things aren't working. Like we may think at one state agency, we have this great idea and it's wonderful. And a parent's like, well, you know what happens when you make that policy change? This impacts me over here in this other program. And sometimes we just can't see those because of the work that we do. They also can help us with helping to identify what's not working as it relates to access and equity. They're aware of what the gaps are. They're aware of where needs aren't being met. There's that peer-to-peer impact where they, social capital changes as a result of this. Like people build their resumes and are able to really do some great work. A lot of times it's considered this parent leadership piece self-transformative, really can make or break or change lives to have parents feel that they're contributing. So that they will show another video here in a minute, but parents who have started with some of these parent leadership groups throughout the country who have then turned into city council and state legislators, and it gives me goosebumps kind of talking about it because it's really cool. So we've seen those policy gains, and they definitely have their thumb on the issues around equity and access. No matter what we do in this state to try to encourage more diversity in our workforce, it's never going to match our families. It's likely never going to match our families. Not completely, right? There's always going to be sort of this disparity. As long as there's disparity in the world, and there is disparity with race and with income and all of those things, our professionals and our service providers are never fully going to match the families that we serve and that we work with. And so it's really important to listen to them because they make up our consumers. So here's sort of a continuum when we think about family engagement and how it moves across the continuum of engaging families to really pushing towards that leadership piece. So this is actually from Iowa, did a lot of work with their FADS program and is doing some piloting around some 2-generation initiatives. And this actually I took out of their document, but really showing the different levels. And how would you evaluate sort of your organization? Are you occasionally asking for input through maybe more informal, just saying, hey, how'd you like that? Do you have a more formal mechanism? Do you routinely ask for it? Do you do it once a year or every 6 months, or how often? Or all the way up to, are you really providing parents with the opportunity to lead, to really take a leading role in the work that we're doing? When we started this, kind of restarted this group used to function, and then it kind of fizzled for a little while, and a couple years ago I was asked to kind of revive it, and that's how I got involved. And PJ and I and Tom Rendon got on a phone call with the state of Michigan, and I was so impressed with what Michigan does. So what Michigan does is they have their early childhood boards, but they also have an early childhood parent board, and these boards are seen as sort of co-equals, and decisions and things don't get passed unless both boards, the parent-led board and the professional-led board, sort of agree to it. So we are really far from that, but it doesn't mean we can't get there someday. So this next video is if you've done any of this work before, you've probably heard of Elaine Zimmerman, and this is the National Parent Leadership Institute, and this work really started out of Connecticut. So we'll watch this short little clip.
I want my child to be safe. I want her to be a part of the community. I want her to give back. Being a parent leader means taking responsibility, not only for your children, but the community that your children live in.
What I wanted to do for the grandchildren and the children was to give them an opportunity to be successful, and then give them an opportunity to find their identity, to find their voice, to find their way in the educational system that we have. Everything was about the child, because we believe that the children are sacred.
There's a common thread connecting parents across the country. It transcends the neighborhoods we come from, our economic status, and our level of education. It's the unshakable desire for better. A better education, a better place to play, better conditions in general than what we have now. Yet most of us don't know how to affect change for our children.
Parents really want the best for their children, but they don't perceive themselves as a constituency for public change for children. And that's because they don't have a civic toolkit, because nobody teaches that. And it's also because they've been really marginalized in public policy debate and discourse.
The sense that parents are not taken seriously is what influenced a group of Connecticut parents in 1992 to change this perception. What they found is that parents from all walks of life, all around the country, feel the same way. What they came up with is a nonpartisan initiative that offers a caring community of parents and a comprehensive training program that provides substantive leadership skills. This powerful combination gives parents the confidence and the tools needed to effectively communicate and make a difference in the civic arena. Called the Parent Leadership Training Institute, the initiative is nationwide and continues to gain momentum.
So the Parent Leadership Training Institute is a democracy school for parents that teaches parents how change occurs for children in our country, in different states, in different cities, how it works. Parents learn what public policy is, how budgets work. They learn to know whether a program is succeeding or not. They learn to understand and look at numbers. They learn how to talk publicly. They learn how government works. They learn who's in charge. It creates great efficiency so that they can lead without needing to go to 22 different places and feeling lost.
When I was looking for a project to do, I asked the school nurse to talk to me about some of the problems or issues that they have. And one of her main pet peeves was kids coming to school sick. And I asked her, well, why are they coming to school sick? And she said the kids would say when she asked them, did you take your temperature at home? And they would say, no, we don't have a thermometer. And I thought, oh, that's something tangible I could do. Let's get thermometers. And I talked with Walgreens, and they came on board, and they decided to supply me with all the thermometers that I requested. And it was a huge success.
Parent Leadership Training Institute gave us 20 weeks of training. And basically, there's a whole range of skills you'll develop. With the training, we were able to develop projects, write letters, get organized. And so that's how the Institute assisted me in developing my skills so that I might better help my grandchildren in their educational journey.
Concerned parents and ready communities can do this, but it has to be made available to parents in order for them to participate. Which raises the question, what does it take to get PLTI into more communities nationwide?
They can contact us. We'll be glad to help them bring together members of their community, bring together parents, find out if parents want this. If they do, we'll help train facilitators in their community. We'll help certify them and help them design the infrastructure so that this will be sustainable. We also provide ongoing, for 3 years, technical assistance so that the quality control endures, because we know this works 100% if it's practiced with fidelity. We have thousands of graduates in our state and now around the country.
Parent leadership is proven to improve education gains for children, decrease healthcare costs, and bolster overall community safety. Not to mention the impact it has on children who see their parents as influential advocates working hard on their behalf.
Over the years, I start to see the leadership in her, and that's what's really overwhelming, because you really start to see a little bit. And I never pressured her into getting involved, and just recently, in the last 2 years, she's starting to sign up for things, volunteering and something. That's how it starts.
This isn't wishful thinking. This is really happening. Outcome data reveals that 92% of parents who graduate from the program say they now address community issues. This is an almost 50% increase in participation when looking at statistics from before parents enter the program.
I just think that PLTI is a great opportunity for parents and grandparents. You know, I go to the graduation in Meriden every single year to congratulate our graduates because I believe in the program so strongly. And I think it's a great tool for parents to learn how to advocate for themselves, for their children, for their communities.
We want to help any parent interested in leading for their child and other children to acquire a civic toolkit so they can do this really well and improve child outcomes.
The Parent Leadership Training Institute, helping parents who care become parents who.
All right, I only have like 8 minutes left, so I'm going to use those minutes to tell you now what we kind of need and want and are hoping you all can help us with. So as I mentioned, there is a ECI Family Partnership Work Group Committee, whatever you want to call it, that kind of sits under governance as part of the ECI structure. We developed a mission statement and these value statements, which we have up there. Really, again, getting back to that intentional and authentic engagement of families. What we don't want to do is just say, this is important, do it, and we said so, right? What we want is for people to recognize and understand and appreciate the value in what this work can offer to all of us. So we had, initially we started with sort of this mission and value statement. We have developed what we call a Plan, Do, Study, Act. I'll also say, I don't know if I plugged this yesterday, but if there are people who really have a passion for this work and are interested, you're always welcome to join us. I think I threw this next slide in, but it went backwards. So I'm gonna say this is right now who is represented on that committee. I threw it in the wrong place, but we have right now people from PC Iowa, ECI, you know, a lot of different, I mean, there's just a broad representation of different organizations and entities currently, but we would love to have local providers, ECI coordinators, anybody who's interested in this work. It's a really passionate group and it really does kind of feed my soul. So what we have come up with is a pilot sort of Plan, Do, Study, Act. It's a common phrase in continuous quality improvement. We reviewed a lot of things over the last year and a half. I mean, everything out there on family engagement and parent leadership we've looked at, whether it's from Head Start, whether it's Iowa Family Support Standards, I mean, we have just looked at so much information and really decided that before we did anything, it was important for us to sort of take a pulse of what's already happening. So to survey and inventory programs. We spent a long time talking about whether or not we tried to implement something across the entire early childhood spectrum. That felt really big and really overwhelming. So we decided to pilot and focus specifically on Iowa Family Support sites. So specifically, you know, anyone doing home visitation, family support, whether it's ECI funded, McVie funded, prevention dollar funded, whatever, but anyone doing that family support work, to survey what is happening, to get sort of a baseline of what is happening. And then our goal is to take that information, try to do some interventions, try to plan some things, some intermediate trainings, highlight some programs that are best practice, and maybe work with a few sites that are really interested in this. And then really to look at it again and do another survey maybe a year from now and see, you know, are things changing? What else is needed? What more can we do? Because I think we all realize and understand this is important. You know, it was really hard. We had written in when we had hoped to get preschool development grant funds to really propel this work forward. We didn't get those funds, but we don't want this work to stop. It's too important. So we're going to keep plugging away. So what we've done is created a survey. We looked at a number of surveys in this process, including several that really came from an educational one. I really did like this one out of the Center for the Study of Social Policy. And if you're really interested in this work, there is a assessment and toolkit online that you can use to like basically just walk through your entire organization. We borrowed some things from this. We didn't necessarily use the whole thing. Their model really is focused on these sort of 4 pillars of family engagement with 4 dimensions and a 4-point rating scale. Ours is a little different. We have some that are rating scales, some that are yes and no, but they really focus on family-centered, equity, collaborative, and transparent. I think that transparent is really important, is that we're really honest with families about what we can and can't do. I also want to throw out some additional training opportunities. If this is a topic you're really interested in, there is good news for you while you're at home with COVID-19, not with COVID-19, hopefully, but because of COVID-19. Check out some of these modules on the Institute right now. So there's a 2-parter on family engagement, part 1 and 2. I will say it is very specific to home visiting, but I mean, they say home visiting over and over, but the concepts, the skills, it's all relevant to any family support work. So really great about more of that stuff on like self-reflection and checking your own biases and stuff like that. How do I work with families in a strength-based way? And then there's these 2 on cultural humility, which are really done really well. I was just saying yesterday too, I wish that we didn't say supporting immigrant families just on this, because it really is about way more than just families that have immigrated here. It's really about it's really about supporting all of our families, you know, because like I said, we all come with our stuff, whether it's because we are immigrants, or whether we're racial minorities, or whether we're religious minorities, or whether we're disabled. I mean, we all have these aspects that make us who we are. So these are all great. One of the requests yesterday was to put the links in. So the links are in there. They're also in the notes section for you, because as I said, we will send this out. Here are some of those national resources, people that are doing this work nationally. As I said, like, you know, Iowa, outside of some of these individual programs, you know, we've done a good job in some really individual programs for very specific populations, but on a broad level of trying to really provide strong parent leadership opportunities for parents of young children. We just haven't had a real coordinated effort, and that's okay, because it's never too late to start. So I am wrapping up with a whole 2 minutes if anybody has a question that they're burning to ask. But my contact information is on there. This group, we don't have a set schedule. I tend to do a doodle poll. We tend to meet every 1 or 2 months. We always offer up Zoom. So if you're in another part of the state, you're, like I said, welcome to join us. Otherwise, you'll want to be on the lookout for the survey that's coming, and it should be out probably. We want to do some testing of it. We want to have some people test it out, make sure that we're not overlooking things, and then we will send it out. And we really want perspectives from everybody, from frontline family support workers to administrators to community leaders. You know, like, what are your organizations doing? What policies do you have in place? What things are you doing to provide these opportunities for parents? And it's not to say you're right or wrong. We just want to know where people are at and what they need in terms of training and technical assistance, so that we can support the work going forward.
All right, Lisa, I don't see anything coming through. Does anyone have a quick question? They can unmute themselves. Okay. Well, Lisa, you were just so thorough, there are no questions. No,
well, hopefully everybody's not sleeping. Happy Friday.
Oh,
and
no.
yes, we will
Thank
send
you
these slides out.
Yep, we'll get it
Thanks,
out to
guys.
everyone. I just want to do a quick reminder. There is also a call on Monday, which I mentioned at the beginning of the presentation. And next month's Lunch and Learn will be about Count the Kicks. We will have folks from that organization describe ways that you can help prevent stillbirth. So thank you so much. Oh, we did get a message. It says, "We're awake and thank you."
Awesome. I love it. Thank you,
So,
guys.
thank you all for participating. Thank you, Lisa. And we'll call it a day. All right, everybody enjoy your weekend. Bye-bye.